Hello, Assalamu alaikum, good evening. Welcome to another episode of Health is Wealth. I am your host, Shabnam Riaz. Okay, so, in our last program, we had a wonderful discussion and the issue was mental health. There was just so much to talk about, so there was no way we could do justice to it in one program, or even two or three. This would be a whole series of programs. We are again joined by our experts, and we're going to carry on talking about this very, very broad, part of health, because mental health, it seems that sometimes can be pushed aside and people are not focusing on it as they should. So we have with us in the studios once again, thank you for joining us, Dr. Amir Malik Sajjad, consultant psychiatrist and executive medical director for mental health organisation Navigo. Thank you very much for being with us again.
Assalamu alaikum.
Walaikum salam. And we also have Amna Khan, who is a mental health counsellor, and you're with us here today. We look forward to hearing, really, really great pieces of advice from you as well, Amna. Thank you for joining us.
Thank you for having me.
Right, and both our guests are here from the UK, so, we're going to benefit from your experience abroad as well, and how that's applicable to Pakistan, and, many things that we can sort of work together on. Okay, now, in our last program, we got good feedback from people wanting to know more about personality disorders. So, Dr. Amr, I'm going to start with you. If you could just sort of give us an overview of exactly how you do classify people with certain personality disorders.
Absolutely. Fine. Personality disorders, first of all, we need to be aware everybody has got their own personality, and that doesn't mean that everybody has got disorder.
Right.
Personality disorder is a makeup of your characteristics and how you present yourself to the people around you. This becomes a disorder if that characteristic or cluster of those kind of characteristics of your personality start impacting on your own life or on others' life. So then it becomes a disorder. Usually it starts because of something that might have happened as genetically. So there is a predisposition to develop personality disorders at some stage later in life. And the kind of how you develop, what's the family environment, any untowards happenings, being exposed to unnecessary stress, family discord, abuse, bullying, these can lead to different forms of personality disorders. How we tend to classify, each personality disorder has got its own set of symptoms and signs. But the American classification system called DSM actually puts them in three main clusters, called cluster 1, 2, and 3. Cluster 1 is the personality disorder where we've got people with mostly with the disorders which we call mad disorders kind of thing. Like it is where your insight is slightly impaired and you might be losing touch with reality. It's like schizotypal, there are different names, schizotypal, schizoid type of personalities, paranoid type of personalities. Second cluster is where these individuals might be falling out with their peers, with their families, and with the law as well. So this is called kind of bad ones in this case, because they are usually having some kind of offending behaviors as well.
Okay.
Usually dissocial personality disorder comes into that. Other names are, there are a lot of terminologies which we call as layman's terminology, like antisocial or sociopath, but that's all about dissocial personalities. 10 people in the prisons could have those disorders, especially if they've got no remorse on what they've done, no concerns about others' feelings, and there's a kind of repetitiveness of the behavior. Within that category of kind of still, this cluster 2 is narcissistic personalities, people who actually try to, unconsciously, they would like to take over the situation, they would like to impose themselves on others.
And is it also sort of making you feel better at the expense of another person as well?
Yes.
To make them feel inferior so you feel superior, is that part of it too?
Well, yes, that's what comes across, but that does not necessarily mean that this is what is intentional behavior. This is how personality is made up. Like we are behaving, we tend not to actually kind of bring this up. It's always there. So and that's what I'm saying. It's not usually to gain anything out of that. It's not like having a secondary gain from that behavior, but that's the personality makeup, that they would be actually acting like that without knowing that this might be causing any discomfort, any distress to other person. The third category is where we say these are the cluster of people where people tend to have mood symptoms. They could have depressive personalities, anxiety type personalities. People can also have dependent personalities. People would actually find it very difficult to do anything without their confidant or somebody who they depend on. Similarly, obsessive type of personality. So that helps as clinicians for us to kind of categorize in some way or form to see what's best, what can we do to offer them any kind of therapy if that's available.
Right. So the first step is to, find out exactly what's happening.
Yeah.
Okay. Amna, tell us, in working in mental health, working with psychiatrists and psychologists as well, where do you come in? Where is, how do you help with people, getting the best mental health?
So basically how I would help is, as Dr. Amir has said, that once the personality types have been sort of identified, I mean there's, I would sort of come in more sort of in the third category or sometimes in the second category as well.
Okay.
Generally people in the first or second category who are more sort of schizophrenic or more towards like psychopathic, their behavior is more psychopathic, or narcissistic personalities or sociopaths, they sort of tend not to recognize really what is actually happening for them, because they're so detached from reality. They live in their own worlds, and they feel what they're doing is absolutely right. So it is quite difficult. It's very challenging actually to reach out to them unless they're willing, because they feel they're right in whatever they do. And they project a lot of their hurt or their feelings onto other people as well. So there's a lot of projection going on, and they blame others for what's happened to them or what they do. It's never their fault, whatever they do. As far as the third type of sort of category that Dr. Saab just said, it's anxiety disorder or people with depressive personalities or anger issues. There's all kind of different sort of disorders there. So that's where I come in, because what I do is I help people identify what's really happening for them, where these feelings and thoughts are coming, which is actually making them so uneasy, or makes them difficult to cope, get on with day-to-day activities. What's happening for them, identifying and then giving them the tools and the coping mechanisms to sort of carry on. So I offer them that support.
Right.
So that's where I come in.
Of course, and of course that is very valuable support as well. When we're talking about different personalities and the way a person is, of course, is what the characteristics that they're born with. When we talk about introverts and extroverts, are both sort of equally vulnerable to get the same sort of mental health issues, or does a certain personality carry more of a vulnerability to, let's say, anxiety, depression, or something like that?
We talk about pre-morbid personalities, because usually when somebody comes in contact with any kind of mental health services, that is down to an episode. Something would have happened that might have triggered something which was kind of was there but wasn't on the surface, so it has triggered something.
Right.
And that episode would actually have something to bear with what the personality was prior to that. That's why it's called pre-morbid personality, prior to the episode. So as we've been talking about different clusters, personalities are unintentional. So that's because somebody has been born with having those genetic makeup to make them kind of more prone to become like having a certain personality. But the environment is contributing to that. So once that thing has happened, then I think we have to be careful that we need to recognize how the person is coming from pre-morbid personality, and that could tell us what's going to happen in their later life. So we talk about the category 3 or cluster 3 mood or anxiety related categories. Those people tend to actually become more anxious. the personality actually triggers itself, or personality comes out when they have to deal with some kind of stress, something that's out of their normal routines, something that puts slight pressure to try to adapt some change, and this is where personality comes out. So a person who is dependent might be cared for quite some time, but they are dependent. As soon as the caregiver disappears or is no longer able to do that, that dependent personality becomes very dysfunctional. So now you will see all kind of mood symptoms coming up, all kind of anxiety symptoms coming up, and that episode is now triggered. So a lot of time personalities go unrecognized till actually they get triggered.
Something happens that brings it forward.
Yes.
Okay, now something very interesting, I think, is that when we talk about life in Pakistan and life in the West, the same person living here, the same person living abroad. Here we're used to a broad network of family support and a lot of emotional support. Usually if a person is going to a doctor's or is going somewhere, they'll have at least 2 people with them, So when people sort of go abroad and they're used to that sort of, especially girls who get married at a young age, and they find that they're moving abroad. And then they find themselves that their family isn't there, their friends aren't there, and they're completely, isolated. And they fall into a lot of depression. So how is that dealt with? Because that must be quite a huge phenomenon.
I think at one stage when we're talking about how much families do for each other, luckily in our countries, something goes unrecognized is how much pressure it puts on the families. Something that we very commonly we do in UK is when we are actually offering some service to our patients, we are actually offering some kind of service to the carers as well. Because one person when becomes mentally unwell, it's got a huge impact on the rest of the family. And that's quite a bit of contrast from physical health problem, because physical health is affecting individual, not the surrounding, or mental health does. So I think, it's very credible to the work we do with our families, but we don't really offer something to the families who are caregivers in that situation. And this really becomes a lot more exposed and on the surface when that care is taken out, when girls get married, go abroad for education, if kids go somewhere when they've been quite dependent on their parents. So I think there is a lot of support available in UK for the carers. We don't have that here, and that is something which is very formalized in UK.
Yeah, because I think there's more of a structure there of how, and it's really recognized. I've had so many clients who come to me, patients actually, who are actually going through the stress, and it's so traumatic looking after somebody, not just the depression and they've got autistic children, or somebody might come whose husband might be terminally ill, or somebody's parent is really ill. So caring for them requires so much strength well, and it's a constant stress because they have to manage so much. So they actually require therapy, and they require the support and the care and how to cope, because it's really very hard. So that's something which is probably not recognized here. There's a huge family
structure. So we'll get back to this right now. I have to take a break.
Sure.
And don't change the channel. Okay, welcome back to the programme. Arno, before we went for the break, we were talking about personality disorders, how they come back to you as well. One thing I wanted to talk about is, you see a lot of this in Pakistan at the moment, is anger management. People getting furious, a situation in just a few, seconds, spiralling out of control.
Yeah.
Tell us about that.
Yeah, I mean, it's sort of referred to as rage. And I think a lot of people hold that within themselves. As we were talking about a little bit earlier, Dr. Ahmed had said that our personalities are actually formed very early on in childhood. It could, and social, environmental, all our external influences, and obviously influences at home, how we are brought up, all those things affect us and how we sort of grow up and how we tend to be and how we deal with things. Anger is generally sort of a form of repressed pain. That is something which is not sort of seen. You see a person, raging or getting angry or, maybe swearing or whatever and, shouting, yelling, screaming. But actually, when people come to me for therapy and I actually sort of go to the root of the problem and really sort of try to find out what's happening for them, what generally comes out is that there's a lot of pain behind that anger and people don't recognize it. So it's sort of as I sort of refer to it as repressed pain. And
so it sort of goes unchecked.
It goes unchecked, and what happens is they may have anger towards something that may have happened in their past. Could be some form of abuse or something. They may have lost a parent. They might not have dealt with a certain kind of grief. They may be angry towards somebody, something in their past with their parent or with a sibling, or they may have been bullied. There's so many things that happen.
Right.
So that sort of is projected to the outside world. And then anger, there's again two forms of anger. There's one anger that's sort of externalized and projected to everybody around you.
Right.
And then there's one form of anger which is internalized anger, where you internalize the anger towards yourself. And then you sort of can tend to go into depression, or you could go towards things like drugs or self-harm or excessive smoking or drinking or things like that, where you are sort of targeting the anger towards yourself.
You're basically punishing yourself.
For something that's happened.
Right.
But I think that the main thing here to sort of understand is that one has to recognize where this anger is coming from. And why it's not a normal form of behavior. So if you or anyone in your family or around you, you see there's excessive forms of anger, rage, then it should be, so the help should be sought.
Needs help.
Because, and a lot of people also...
Because it can get out of control.
It can get out of control. And then also, another form of anger also is people become silent, like giving the silent treatment to someone. That's a way of, it's
extreme anger.
Extreme anger. And that's
when you're
punishing.
So angry that you can't say anything about
You can't say
address
anything.
your feelings.
You're completely sort of consumed by your emotions, and it sort of decapacitates you. You're not able to sort of deal with anything, deal with anybody. That is extreme form of anger as well. And that's something which narcissists tend to do. Silent treatment or stonewalling, it's called.
Right.
Or sociopaths, they tend to do that a lot.
Right. Okay. So what you mentioned, that is so important. So many times you feel, not just with other people, but yourself as well. You'll find that you're carrying anger around that hasn't been addressed. And so it's one of the first step is to identify it.
Absolutely.
And then talk about it and bring it to the surface so that a person can resolve issues, as you've said, Amna.
Yeah.
Okay, Dr. Amna, what I'd like to ask you, Amna mentioned self-harm. One of the causes, anger. What are the other causes, and how should they be on the lookout, or family members?
Fine, there are a few very kind of conventional ways of self-harming, which would include like self-induced poisonings or deliberate self-harm of cutting kind of thing. And there are other forms of more newer forms of self-harm is detachment, living in virtual reality, like being detached from others and being more in kind of with gadgets, with social medias, and not going out. But I think the thing which is really important, and we talked about it in the last program as well, your forming years are your early your middle childhood and adolescent years. The more the parent is away from their child, the more the lack of attachment is there. You would not be able to pick up these clues till actually an episode triggers, and the child might actually present into kind of some critical services. So that's important, that you need to recognize that there is a value of parenthood. You should be having a regular dialogue with your child, good or bad. But
good or bad. I think that is really important, what you just said, good or bad. The thing is to remain in touch so that the child knows that you're there. I mean, even if you're a nagging parent who's, that's a very important point.
Communication,
Yeah.
I think the worst is actually having an different attitude from
That's
parents.
true.
And this is where I think you might not recognize what's going on in your child's life till they actually present where you have never thought of that they might be like that. So that's important. What we actually tend to see, I think if you do any audits on how many people present to you to kind of accident and emergencies, you would see that there are a lot of time people are presenting there. What triggers that? That could be just kind of very menial thing. There might be a family, just a breakdown of relationship, maybe some exchange of words, an argument might have triggered something like that. That does happen in a lot of cases that we see in our emergency departments. Underlying disorders. One of the personality disorder we call emotionally unstable personality disorder, and there's a further type within this emotionally unstable is a borderline personality. People tend to have low self-esteem, and these, in any stressful situation, they would actually like to inflict physical pain to suppress the emotional pain. So personality disorder of this type can actually lead to that. Depressive illnesses, when there is gloom, there's lack of hope, kind of the hope is not there. People tend to actually go into self-harm, and this is where we have to be really careful. That is this the self-harm to kind of ventilate your emotions and trying to take control on your body, or is it something geared to end their life or take their life? Because suicide or parasuicidal behavior goes quite alongside with the self-harm.
Who's at risk from, I mean, what actually happens to a person for them to contemplate suicide? Is it, can it be a broad set of circumstances, or do we find specific people who are, who are vulnerable to this?
I mean, there's no one single kind of fit or answer to that, because your life circumstances, sudden loss of relationship could actually make somebody so vulnerable to actually go to that extreme. A pervasive pattern of self-harm can actually lead to an accidental suicide or parasuicidal act. Similarly, I think a lot of time how the society is supporting us, that has got impact on suicidal behavior. What we tend to come across in the news, very sad, we tend to see somebody who was a drug addict was found dead on the train lines or tracks. Similarly, people who have got, who are sadly at the lower end of the poverty line, below poverty line, they are quite vulnerable because people are struggling to kind of get both ends meet either. So there's a wide variety. Not everything is related to mental disorder, because a lot of time people do act very impulsively. They do not really think what's going to happen.
Nothing, you didn't have any warning signs.
Exactly.
A lot of they might be very feeling helpless or no hope in their life. They've lost touch with reality completely, sort of in their own sort of world, and
what
they
about,
think that's the only way out.
Situations where you see people that you thought and they were rather, happy or okay or content, and all of a sudden a shocking news comes across that this has happened. How can parents, family members, loved ones, friends, how can they look out for warning signs? What's there to be sort of mindful of?
Well, I think it's, as we were saying earlier, communication is very important. See, good mental health is basically a lot, it comprises of our thoughts and our feelings. A lot of the time, the feelings are not given that much importance. A lot of people then suppress what they're actually feeling, what's happening for them. How we are acting, how we are coping with day-to-day activities. If you notice somebody being jittery, very anxious, not eating or sleeping well, so sort of disturbed sleeping or eating patterns, you're not being able to cope with day-to-day activities, work, school, if you're
a change in mood.
Having low or little energy, not wanting to get out of bed, having mood swings. Isolation is another thing where you're completely isolated from not wanting to do anything, not wanting to meet anybody. So these are sort of a few warning signs which should if there's 2 or 3 of them happening, then one should wonder. And then I think the best thing is, I'm not saying rush to the, but if as a family member, or
Yeah.
if you have a friend who is going through that, communicate, try to find out what's happening. Sometimes just such people who are going through certain difficult emotions, they find it very difficult to reach out because they're so sort of trapped in their own world.
So true.
I believe that, you know, people who are going through depression or difficult times, they might have a smile on their face. They might be holding up very well, but they might be going through a huge chaos within themselves. And I think it's important to sort of, if you see these signs, try to reach out, try to see if you can help them, support them in any way.
Exactly.
Obviously, someone like me or Dr. Amrit come a bit later, but within your family or friends,
They'll be the
if
first
you're able,
people
first
to
people, and I think that support is very important as well.
I think at the same time, we've touched up on that stigma.
Oh, yes.
Stigma is the massive thing.
Absolutely.
I think we need to be careful. We should not just be relying on the biological treatment. Okay, somebody has taken an overdose or self-induced poisoning, go and get them some kind of antidote, get them gastric kind of wash or lavage, we call it, and leave it there because they're out of episode. No, something has triggered that extreme response.
It has to be dealt with.
It has to be dealt with.
Yeah.
So it's not the physical repair. Emotional repair is required. So I think any signs of that kind of self-destructive behavior should be alarm. It should be an alarm for us to really get more closer to having understanding of what's going on in our loved one's life, and try to get them right support. And I mean, situation is not as bad as we might be thinking. There are loads of services, loads of supports available. People who present to A&E, they get referred to psychiatry team, they get referred to psychologists working in hospitals. I think all self-harm needs to be explored carefully, and families just do not go and get them checked in A&E and then revert
And
from
then
there.
just
I mean,
forget about it
don't
because-
be dismissive. I would also want to say to your
Right,
viewers,
right.
and it requires a lot of courage actually to actually recognize that there's something going on and seeking that help. And if you see that in somebody, or if somebody actually reaches out to you, do take it seriously. Be receptive, because it does require courage. It's not easy.
Of
and there's a
course.
lot of stigma attached to it. Yes, I agree. Out here, because people just expect you to just sort of get on with it and say, oh, it's okay.
They
or
perceive it as a weakness.
they see it as a weakness, or even, you know, obviously...
Or a failure.
A failure.
I think we said biological model is not the only one, because in biological model, what we're saying, a lot of time people say, well, you are doing well, you got good health, you're eating fine, so why would you go to that extreme?
Yes.
No, I totally agree with Amna. Validate. Okay, do not just dismiss, do not try to kind of cover it up, just say there is something going on. So just have an attitude of be more exploring of what's going on, and recognize that there was something definitely bothering them, that they've gone to that extreme.
Absolutely.
Yeah.
And it is not, you know, the stigma thing, you know, it's not necessarily, there's a lot of sort of concept here about, you know, evil spirits, or, you know, someone's been affected by
That's true.
something like that. It's not
Instead of
necessarily the
taking to
jinns
the-
or the evil
Oh,
spirits affecting you,
Absolutely.
because actually good mental health is actually a very important thing, and it's important for your well-being in every way.
If
So
you
it
allow
should
me
be
to
recognized.
say something which is, I
Please.
think you touched upon a very good point.
Yeah.
Okay, I mean, I think we are all religious people, and we draw a lot of strength from religion, so that's all very positive. We should be doing it. But there are so much of quack stuff going on. People are actually going to people to get kind of resolution of their problems. That does not really need to be done that way, and
in
people
fact
are getting
makes it
exploited.
worse.
They get exploited.
Yes.
There is, I mean, if somebody is hearing kind of things which other people are not hearing or seeing things, that's a psychiatric illness.
Yes,
it's a
absolutely.
psychosis.
That's
it's
so
treatable,
true. That's
and
so
there are
true.
very good antipsychotic treatments and therapies available that should be looked into rather than being kind of exploited by the quacks.
Absolutely true.
Yeah.
Okay, so let's also talk about post-traumatic stress disorder. What are the signs?
Yeah.
Could somebody be suffering from it and not know?
I think what we tend to see, there has to be a trauma, first of all, and there should be a definite change in how they present.
But then when we talk about trauma, does it have to be something really...
No, it doesn't have to be of
Can it mean different things to different people?
everybody's got their own kind of threshold of receiving the traumatic news or watching or being subjected to that. Trauma is, you actually would see a lot of withdrawal behavior. You will see startle reaction. People with the same exposure would actually trigger some kind of very extreme anxiety response. People tend to get nightmares. They will get dreams of what's going on, and there would be an avoidance. They would not really want to go there. If somebody has seen some kind of terrorism act, sadly that's is something media is also has to be very responsible how they actually present that. If you see that people are actually withdrawing from watching some of the news because they said, oh, we're not getting any good news. So we are actually inducing a traumatic theme in people. And that avoidance behavior in some way or form is actually getting us to have some kind of post-traumatic symptoms. It becomes disorder. We touched upon that. If you have a pervasive pattern of behavior for a certain time, then it's a disorder and you should be seeking treatment. People can present with all depressive symptoms, anxiety symptoms, but the most important thing is traumatic people can also be very risky towards themselves because the trauma is really impairing in their life. I would say AMNA deals with a lot of those things, but the recognized treatment for trauma, and there are experts available all over the country as well, it's called EMDR. It's eye movement desensitization and reprocessing, where we actually tend to stimulate both parts of the brain by either eye movements or hand movements, and the purpose is to stimulate both brains and try to resolve the memories of a traumatic event into kind of unresolved memories into resolved memories, where the memory of the trauma will still be there, but the emotional component would be resolved. So that's something which is very recognized in Europe, in America. It actually started from America, but Europe has adopted that. And there are centers in the country as well. And we know that trauma has, our trauma sufferers list keeps growing sadly, starting from the earthquake back in 2005, and a lot of people did a lot of charity work, NGOs came into play. But then there's ongoing trauma where we're seeing when things actually get out of control, and sometimes we actually do get terrorism. So that is affecting our nation, sadly.
It does, and I think trauma, post-traumatic stress disorder can occur at any time of your life. Something may have happened to you 15 years ago, and then something small could trigger something in your current life, and then you wouldn't quite know what's happening to you. You might become very sad or detach yourself from people or can't stop crying, or you could react in different ways, and that's what happens. And you may have had some sort of loss or dealt with some sort of a death in the family, even losing a parent. Obviously earthquakes and terrorism acts, those are obviously, that's one level, but then there's obviously personal things that could have happened to you, abuse, all sorts, emotional, physical, any sort of abuse that you suffer from, and that could sort of trigger and at any point in your life. I mean, there's so many horrific incidents that have happened. In fact, somebody had mentioned to me a couple of years ago when we had that horrible attack in Peshawar on the school kids.
The Army Public School.
A lot of the parents and the families who lost their children, they were affected by this, and it was very difficult, and they needed that support at the time.
Of course.
And sometimes children internalize those things and they just sort of close down their emotions because that's how children are, but it might come back sometime later in their life, and how they'll deal with it at the time is a huge challenge then.
And what about social media? Because sometimes when you're going through your news feed, you see, all of a sudden you can see sort of really grotesque or gruesome pictures, and videos even, where something really, really violent or horrific is taking place, and then all of a sudden you're caught unaware and you've seen a segment of that. And that's traumatic as well, is it not?
And that could trigger an episode of suppressed traumatic memories, and that can actually, as Amna was saying, it's quite possible that this would not have come to surface, but there might be something quite scarred from earlier on in life, but that will come to surface, and that's really important. What we have, I think we did touch upon that. Social media or the media itself, we have to be really careful on how we are kind of bringing out these news. There has to be a responsibility on.
Because you are providing a climate for your viewer.
You are providing a climate,
If you are, consistently just feeding them with all the bad things that are happening around.
Well, it does not mean that reality should not be brought to the surface. That's really important. People should be realistic and talk factual. But anything that really happens to that kind of extent, there's a lot of forensic investigation required.
Right.
And sadly, what we have seen, and I think the audience would actually agree with me, we tend to see some of the very crucial evidence coming to surface. Rather, it should be gone into the hands of investigators, because there's vital pieces of information there. So I think we have to really exercise caution and responsibility in how we actually post those.
Absolutely. Okay, another interesting sort of part of mental health, phobias. What are the most common ones, and do they differ from place to place around the world, or do you see sort of a generalized occurrence everywhere, or is it?
See, phobias again is it's very real for a person who's actually going through a phobia. You could have phobias from spiders or heights or snakes or different things. I mean, there's small things which would cause, and they trigger a really bad nervous reaction. So sometimes someone who might have a phobia of spiders, and if even if you throw like a toy at them, you don't realize what effect it can have on them. It can, people can seriously have breakdowns.
And the panic attacks.
And panic attacks, absolutely. So it's very real for them, and the fear that they hold. So how I work is, obviously I use certain NLP techniques as well. NLP is neuro-linguistic programming, and that's quite good to deal with phobias, where you try to sort of get them in touch with where the fear is coming from, and then trying and sort of get them out of it. There's certain techniques I use, but the thing is, it's all in their mind, and it's very, very real. And and they may have developed that fear from something that happened in their childhood, and that stays with them.
That's something that is being taken forward. Again, we have come to the end of our program, sadly, and we've just touched the tip of the iceberg, I would say, when talking about phobias as well. So that's something that we can definitely discuss in a future program sometime. So Dr. Amna, thank you very much for being with us here today for today's program. And I'm sure the viewers have really benefited from all this expert advice.
Thank you so much. Thank you.
Okay, so we're at the end of today's program. Sadly, as usual, there was so much we wanted to talk about, elaborate on, but we weren't able to because of constraints of time. But this is something to be taken very seriously, and I hope you have benefited as well from the great advice that we've had from our experts who were with us today. So take these things very seriously. As was said on the program, don't be dismissive. Try and notice what's going on around you, especially friends and loved ones. You never know how you may be able to help them in a way that they need. So stay happy and stay healthy. Till next week. Bye bye.